Chlamydia is a common sexually transmitted infection, or STI. It is caused by a bacterium called Chlamydia trachomatis. This bacteria infects the urinary and reproductive organs. Anyone who is sexually active can get chlamydia. It's important to remember that STIs, including chlamydia, are treatable. Many people have misconceptions about STIs, leading to shame and stigma. It's crucial to approach this topic with an open mind and understand that anyone can contract chlamydia. Knowledge and awareness are key to prevention and early detection. Chlamydia often doesn't cause noticeable symptoms. This makes it particularly important to get tested regularly, especially if you are sexually active. Untreated chlamydia can lead to serious health complications. Early detection and treatment are essential in managing chlamydia and preventing its spread. If you have any concerns or questions about chlamydia, consult a healthcare professional for accurate information and guidance. Chlamydia is incredibly common, especially among young people. In fact, it's one of the most frequently reported STIs in the United States. Millions of new cases are diagnosed each year. The high prevalence of chlamydia emphasizes the importance of regular testing. Many people don't realize they have the infection because they don't experience any symptoms. This increases the risk of unknowingly transmitting it to others. It's vital to understand that contracting chlamydia is not a reflection of one's character. It's a common infection that can affect anyone who is sexually active. Openly discussing sexual health with your partner and healthcare provider can help break down stigma and encourage testing. Regular screenings for chlamydia and other STIs should be a routine part of healthcare, especially for sexually active individuals. Remember, early detection is key to effective treatment and preventing long-term health issues. Chlamydia spreads through sexual contact. This includes vaginal, anal, and oral sex. You can get chlamydia even if your partner doesn't ejaculate. It's important to note that you can contract chlamydia from an infected partner even if they don't have any visible symptoms. This is why regular testing is so critical, even if you believe you and your partner are healthy. Chlamydia can also be passed from a pregnant woman to her baby during childbirth. This can lead to serious health problems for the infant. Pregnant women should be tested for chlamydia to protect both themselves and their babies. It's a myth that chlamydia can be spread through casual contact like hugging, kissing, or sharing utensils. The bacteria can only be transmitted through sexual fluids. However, practicing safe sex by using condoms is always the best way to protect yourself from chlamydia and other STIs. One of the trickiest things about chlamydia is that it often doesn't cause any symptoms. This means you can have the infection and not even know it. This is why it's often called the silent infection. When symptoms don't appear, it's easy to unknowingly transmit chlamydia to others. This highlights the importance of regular testing, as it's the only way to know for sure if you have the infection. The absence of symptoms doesn't mean chlamydia is harmless. Even without noticeable signs, the infection can still cause damage to the reproductive system if left untreated. If you are sexually active, don't wait for symptoms to appear before getting tested. Talk to your healthcare provider about getting screened for chlamydia and other STIs. Early detection and treatment are vital for protecting your long-term health. Section 5. Recognizing the signs. Symptoms of chlamydia. While chlamydia often doesn't cause symptoms, it's still important to be aware of the signs and seek medical attention if they arise. In some cases, chlamydia can manifest with noticeable symptoms, usually within 1 to 3 weeks after infection. For women, symptoms may include painful urination, abnormal vaginal discharge, bleeding between periods, pain during sex. Men may experience painful urination, discharge from the penis, pain or swelling in the testicles. It's crucial to remember that these symptoms can also be caused by other conditions. Therefore, it's essential to consult a healthcare professional for an accurate diagnosis if you experience any of these signs. Self-treating based on symptoms alone is not recommended. It's also possible to have chlamydia in the throat or rectum without experiencing any symptoms. This further emphasizes the importance of regular testing, especially if you engage in oral or anal sex. Section 6. Diagnosing chlamydia. What to expect. Getting tested for chlamydia is a simple and confidential process. Your healthcare provider will guide you through the procedure and address any concerns you may have. The most common way to diagnose chlamydia is through a urine test. The test detects the presence of the bacteria in your urine. In some cases, a swab might be used to collect a sample from the vagina, cervix, urethra, or rectum. These samples are then analyzed in a laboratory. Results are usually available within a few days to a week, depending on the testing facility. Your healthcare provider will contact you to discuss the results and recommend the next steps. Early diagnosis is crucial for preventing the spread of chlamydia and potential complications. Remember, there's no shame in getting tested, and it's a responsible step in taking control of your sexual health. Section 7. Treatment options for chlamydia. The good news is that chlamydia is easily treatable with antibiotics. If you test positive for chlamydia, your healthcare provider will prescribe a course of antibiotics to clear the infection. It's crucial to take the full course of antibiotics as prescribed, even if your symptoms improve or disappear before completing the medication. This ensures that the infection is completely eradicated and reduces the risk of developing antibiotic resistance. Your partner or partners should also be tested and treated for chlamydia, even if they don't have symptoms. This helps prevent reinfection and further spread of the bacteria. It's important to abstain from sexual activity until you and your partner or partners have completed the full course of antibiotics and are given the all clear by your healthcare provider. Section 8. The risks of untreated chlamydia. While easily treatable, untreated chlamydia can have serious and long-term health consequences. It's essential to understand the potential risks associated with delaying or neglecting treatment. For women, untreated chlamydia can lead to pelvic inflammatory disease, chronic pelvic pain, ectopic pregnancy, and infertility. In men, untreated chlamydia can cause epididymitis, prostatitis, and infertility. Untreated chlamydia can also increase the risk of contracting other STIs, including HIV. Prompt treatment is vital to prevent these complications. If you have any concerns or suspect you may have been exposed to chlamydia, don't hesitate to seek medical attention. Section 9. Protecting yourself. Chlamydia prevention. Preventing chlamydia is the best way to protect your sexual health. By adopting responsible practices, you can significantly reduce your risk of contracting and spreading the infection. The most effective way to prevent chlamydia is to abstain from sexual activity. However, for those who are sexually active, consistent and correct condom use is crucial. Condoms act as a barrier, preventing the exchange of sexual fluids that can transmit chlamydia. Limiting your number of sexual partners can also reduce your risk of exposure to chlamydia. Openly communicating with your partner or partners about your sexual history and getting tested together can foster a safe and responsible approach to sexual health. Regular testing for chlamydia and other STIs is essential, even if you don't have any symptoms. Early detection allows for prompt treatment, preventing potential complications and further transmission. Remember, prevention is always better than cure. Taking proactive steps to protect yourself from chlamydia is a vital part of maintaining good sexual health. Section 10. Prioritizing your sexual health. Your sexual health is an integral part of your overall well-being. It's essential to prioritize it and seek accurate information and care when needed. Don't be afraid to ask your healthcare provider any questions you may have about chlamydia, other STIs, or sexual health in general. They are there to provide you with confidential and non-judgmental support and guidance. Regular screenings for STIs are crucial, especially if you are sexually active. Early detection is key to effective treatment and preventing long-term health issues. Remember, knowledge is power. By staying informed about STIs like chlamydia, you can make responsible decisions about your sexual health and protect yourself and your partners. Your health is worth it.